Hi Jessica, it's Dr. Buford. I'm here with the rest of the team. We're looking in your right shoulder. We examined your shoulder before we started, and what we found is that it was loose to the front, or what we call anterior instability. And as we look inside here, I think we're getting a good idea why. I'm just focusing real quick. So we've got two cannulas coming in the front, a clear one on the left, a gray one on the right. And as we look inside here, I'm going to use my shaver kind of as a pointer. Using the shaver just because it has suction on it right now. We're just flushing the joint like you see there. And so now as we look down here, this is the biceps tendon running up towards the top of the screen here. And the tendon itself looks fine, but look at the insertion here. This is lifted off the bone. Okay, and part of the reason why it looks like that may be an issue for you is because at the tip of this gray cannula is this band, which is the middle glenohumeral ligament. And so it's what we call actually it's called the Buford Complex, and it leads to some biceps anchor instability sometimes, especially in somebody who's athletic, and you can see how this area here could be a problem. See right there? So we're going to fix that for you. That'll provide some stability once you anchor it down. I want it to basically be anchored like it is now. I'm pushing on it from behind with this cannula. See that? So if I push it down, that's the way, back this up a little bit. That's the way I'd like it to look, like that, where it's coming right off of the bone. Right now, you can see every time you rotate or move, especially an external rotation, it really peels off the bone. Look at that, an external rotation. Okay? Now, the other thing that we're going to do is we're going to most likely put a stitch down here. This is the inferior glenohumeral ligament. And although it's visible, you have what we call a drive-through sign. And then this would be the posterior band of the IGL, and there's really not a band there at all. So we're going to put a stitch back here also. So we're going to go off the video for a minute and get to work. Looking from the front to the back, this instrument's called a rasp. We're going to reach down here and just, first we're going to identify the bottom of the shoulder. So that's it right there. That's 6 o'clock in the middle of the screen. That's the front. This is the back. So we're going to be placing a stitch right about here. We use this rasp just to gently roughen up the capsule back here. Take a feel of the labor and make sure it feels solid here. That's pretty good. So now we're going to take our suture hook. We're going to be trying to tighten up this band right in this area here. Here's our suture hook. This is a turn to the left hook. It's loaded with a black wire that you see there. Right about here. Slowly working that through. And we'll feed that through. Okay, so there's the first part of our stitch. You can see how that goes through. We're going to do this as a mattress stitch, so we're going to use the same suture hook one more time. We'll go ahead and take that suture hook. Pause, please. Basically, we'd like our stitch to end up right about here. see our mattress stitch. And now we're going to go ahead and tie that. This part of the procedure is a lot like tying your shoes through a straw. There's our knot pusher. Okay, so now we've got a specialized cutting instrument in. We're going to cut the suture tails just like that. And now you can see what we've done here is created a wall in the back to help support the inferior aspect of the shoulder, because that was one of the directions of your instability. And now we're going to look down the front and I think put in one stitch in the front, but even that one in the back has helped. I just want to further tighten this anterior band of the IGL that you see right there. Okay, so we've got the same rasp instrument in here. You can see the points, and we're just basically roughening up the anterior band of the IGL here. It looks like the labrum. Open up a 1.3 millimeter, why not, please? Here's the switch drill. Okay, so now we're getting ready to use a suture anchor here, just because the labrum looks a little bit suspect. This is an all suture type of anchor. Seated all the way into the bone, and then we pull out the guide, and you can see the sutures there. We'll pull back on the sutures to seat the anchor, just like that, and now that's solidly fixed. So I'm happy with the way that looks. And so the next step is to go ahead and manipulate the sutures. Take a crochet hook, and we'll bring out one of the sutures out the back here. We'll take this one here. We'll hold this in like that. Okay, now we'll take our turn to the right suture hook, and we'll take our rasper in the back. Here's our suture hook. So here we are getting ready to make our stitch. Basically going right through the inferior glenohumeral ligament. Okay, so here's our second stitch. Some more minute. We tied the anterior suture, you can see it there. You can see how much it tightens up the anterior shoulder. And now with our posterior stitch in the back and our one in the front, we have a nice balanced stabilization of the inferior glenohumeral ligament, which I think is really important for your instability. So I'm very happy with the way that looks in the back there. And then here we are in the front. So now we're going to put the camera in the back because we still have that biceps anchor problem to deal with. And we'll show you that in just a minute. Now we're back looking at the biceps anchor. You can see this laxity here. We're going to go ahead and take our shaver. Okay. And we're going to bring our shaver in right in front of the biceps because we have to remove this articular cartilage. This is why just doing an injection wouldn't work because the injection is not going to remove the cartilage. And we have to do that to expect this to heal. So hold the camera right there for me. And we'll show you how this works. Turn this on a little bit and apply a little bit of suction, and in just a minute you'll see what it looks like when the cartilage is removed. You'll see kind of the yellow appearance of the bone below. rotate. We're almost there. You can still see there's a little bit of cartilage we still have to get through. Okay, so there you can see the bone. You can see how thick the cartilage is here. We've had to work quite a bit with our shaver. We'll keep working here because we want to expose a little bit more. See, that looks a little bit better. We'll come a little bit more towards the top. And I think that's going to be enough to get that to heal. So let me pull back, show you where we're at. So see, we're right in front, and that hopefully will stick right down there now. This is our drill guide. We're going to place this guide right in front of the biceps here, basically right where we made that little hole in the bone, or in the, through the cartilage. We'll drill down here. So here we have one suture inside the cannula. You can see the other three sutures are outside. We have our suture hook here, and the trick here is to basically, we'd like to end up with this suture right about there. So we're going to start right about here. Feed that wire in a bunch now. Pause. Okay, so there's the first stitch, and you can see how just that one stitch, how that's really helped anchor down the biceps. I'm very happy with the way that looks. Just to be complete, we're going to place another stitch right here. Okay, so here we've got the slap lesion repaired. Let me just show you what we were trying to do. See how when we tug on this and when we externally rotate, see how now it doesn't pull away from the bone? That's what we were trying to accomplish. And we still have the middle glenohumeral ligament here. We haven't repaired that because it doesn't need to be repaired, but we have repaired the biceps anchor. And then, of course, we've done our work down the front of the shoulder. So we're going to finish up here. It's been less than an hour. We're looking at 45 minutes, which is what we expected. So I really hope this does the trick for you. Good luck to you now. Bye-bye.